Very good afternoon and welcome to Doctors on Call. This 12th day of May 2013. It is another great and a wonderful, wonderful day. For those of you that may not be familiar with Doctors on Call, it is a program where we have a panel of doctors who come to answer your day-to-day questions on your medical issues. Maybe you've been going to the doctors and you're just not getting a solution. So we have a panel of doctors who are going to do that. I'm going to introduce them shortly. But first of all, let me take this opportunity to wish all mothers out there a happy Mother's Day. In case nobody has let you know today, you are all special. Without taking too much time, I'm going to go straight into the panel of doctors that we have with us today. And I'll start off with Dr. Catherine Mutisya, who is a psychiatrist.
My name's Dr. Catherine Syengo Mutisya. I'm a consultant psychiatrist. I finished my undergraduate training in 2000 at the University of Nairobi, then moved in for internship at Kenyatta National Hospital. Since 2003, I enrolled in the program for Masters in Psychiatry, which I qualified in 2006, and since then I've been practicing psychiatry. Psychiatry is basically the diseases of the mind, and basically our patients will present with behavior problems, with thought problems, or mood problems. We see anxiety disorders, depression disorders, schizophrenia, like manic episodes, what we call bipolar mood disorder. We are also seeing a lot of drug abuse and alcoholism. In psychiatry, when I've treated a patient who, especially for the severe cases where you brought somebody who is so psychotic, who is violent, and then you treat them and they really appreciate.
Welcome, Dr. Mutisya. It's good to have you here. Now, as a psychiatrist, I know many of us imagine that you're a mind reader of some sorts. Is that true?
Not really. When we are going through our daily life, interacting with people, we don't really assess them. We only assess when you come to us, or in circumstances where probably the behavior has gone overboard, or it is clearly out of what is expected. But in normal setups, we don't go analyzing people.
Okay, well, I'm glad you don't, because I'd not want you to know what I'm thinking right now. But anyway, that's a story for another day. Next, we have Dr. Ann Kihara, who is not entirely strange to many of us. And, well, Dr. Ann Kihara's profile.
I'm Dr. Ann Beatrice Kihara. I'm an obstetrician and gynecologist. I did my basic degree in the University of Nairobi. Obstetrics and gynecology, in a nutshell, is reproductive health. For the young girls, it's the beginning of menstruation. Are you interested in getting a baby or not? Can we transit your pregnancy safely? For that who doesn't want to conceive, can you use a contraception? Then issues of sexually transmitted infections, that's a part of what I do. But we do know there is a male factor involved. So reproductive health does not exclude men. It actually includes also the men coming and seeing us. If I have a well woman and I have made a difference to a woman that is positive, I'll keep going. I'll keep going. I think that's the biggest satisfaction. Just adding a cubit of quality to her life, I think my day is done.
Welcome to the studio, Dr. Ann Kihara. You are one who has been on this show consistently for quite a number of years now.
Yes, I have.
And I guess today being Mother's Day must be special to you too, because that's what you deal with on a day-to-day basis. How does it feel as a mother?
I'm proud to be one, to begin with, and it was my daughter's birthday yesterday.
Wow.
I wish her post-birthday.
I hope you brought us some cake from yesterday.
I think we gobbled it up.
Okay.
But all the same, I always want to tell women, whether you have or you don't have, you've been given a unique privilege to carry babies.
be proud to be who you are.
Welcome to the studio. Always a pleasure to have you. Next, we have Dr. Naomi Gashara, who is a pediatric cardiologist.
I'm Dr. Naomi Gashara. I'm a pediatrician and a pediatric cardiologist. Pediatric cardiology entails looking after children with heart problems. I did my undergraduate at the Nairobi University, came back for my master's in pediatrics at the University of Nairobi, proceeded to India, Madras Medical Mission for pediatric cardiology. From that, I again went to Italy for a master's in pediatric cardiology, and short courses here and there. On day-to-day basis, I basically practice both pediatrics and pediatric cardiology. The bulk of my work is pediatric cardiology. I don't want to forget my pediatrics, so I still practice. Pediatric cardiology is interesting. You see a mother crying today and really in tears with a family that is breaking up, with a child who is not glowing, and the minute that heart is done, everyone smiles.
Dr. Gashara, welcome into the studio. Is there a specific difference between a pediatric cardiologist and just a cardiologist?
Yes, there is. Pediatrics basically are children who will be born with heart problems or who acquire heart problems, and we practice up to about 15 years, except for adults who mature with their heart problems, having been born with it. So at that point, we continue. While else, the other cardiologists who are adult cardiologists mainly deal with adults.
Okay, so you're dealing with a very delicate part of
Precisely.
Okay, thank you. Then last but by no means least, we have Dr. Helen, who is a general practitioner.
My name is Helen Nanyaka. I do general practice, medical general practice. But I specialize in family health because I'm a PNP. PNP means private nurse practitioner. 60% of our services go to families, meaning that we are so much concerned with the health of the whole unit as a family. So we are tackling problems of mothers, tackling problems of fathers, and tackling problems of children. We see almost all kinds of patients. We see all the diabetics, hypertensives, and treat all maternal child health cases. We do child welfare clinics, circumcisions. We see malaria cases, typhoid cases, all diarrhea cases, yeah. And let's say all tropical diseases. On a day-to-day basis is when a child walks in with fever, they are down and the mother is screaming because the child is convulsing, and they go home. When they are walking and laughing, I really feel very good.
Okay, so those are the 4 doctors that we have with us in the studio. We also have a very good crowd here who you'll be meeting as we go along, hopefully. But just a quick reminder of the doctors that we have and how you can get in touch with us and send us your questions before we begin. We have a psychiatrist, we've got a gynecologist, a pediatric cardiologist, and a general practitioner. Now, this is how you can get in touch. You can SMS on 22355. That's 22355. You can also call us live in the studio, and that's on 4200 600. Try and be as specific as you can with the issue that you may have, so that the doctors are able to help you. And I think I'll start off with the general practitioner, between the general practitioner and the pediatric cardiologist, but maybe the general practitioner. And this is a question that has come via SMS. My baby is 2 weeks old. He cries a lot, folds himself when he is crying. I took him to a pediatrician and was given some medicine called cycloplam. Forgive me if I can't pronounce it. I didn't go to that school of pronunciation. Despite using it, there has been no change. I'm breastfeeding. The milk is not enough, so I give him formula when he is not full. Someone suggested that I should do so, and this is a persistent problem. Dr. Helen.
I think the first thing that we should be thinking about is how are you placing your baby on your breast? because most of the time when we do not have the baby grasp the whole breast, there is a lot of air that is swallowed. And this is the air that goes into the intestines and produces something called colic pain. With the colic pain, the baby will cry and fold themselves. And so for us to sort out something like this, we need to make sure that we wean out our babies immediately they have breastfed. We will make sure that you've placed them on your shoulder and all the wind has come out, so the baby will not cry. Another thing is that medicine may not be of great help here because it is actually wind that we are dealing with most of the time. And giving children like water or extra milk is really not recommended. If the child can be able to breastfeed for 6 months, then this baby will have less problems. So we are saying that proper breastfeeding and weaning out the baby may be a big solution to this problem that you are having for now. But do not rush into medicine because it doesn't really do a lot of help.
Okay.
Maybe I can add on, because breastfeeding is very important, I think, for all of us. But the main thing is most women have this notion that they never produce enough milk. But the more you put the baby to the breast, the more milk you will produce. I'm a little bit worried about this particular client because when she starts mixing it with supplementing feeds, there'll be an element of indigestion even in this little one. So breastfeed as much as possible and make it demand feeding.
Okay. You mentioned about gripe water. If I can just come back to you, Dr. Helen. Does gripe water really help?
Hardly. It's hardly helping because what we are dealing with here is air in the system, in the digestive system, which if it is brought out as early as the stomach, it will not descend to the intestines. And so the colic pain will not be there. So gripe water is water. It's just like water. And that's not recommended really in babies.
Okay, so maybe somebody is just a businessman who came up with a good idea and made some money out of parents. Okay, we'll move on to another question. Sorry?
I would also want to add.
Yes, go right ahead.
Small children and new mothers. I don't know this mother, whether she has another baby or it's her first baby, but we tend to overdress them. So they love them quite a lot. And even us, as we have a cup of tea, we warm up. So when babies are so loved and they're breastfeeding, they'll sleep. So they'll sleep when they are not full. Well fed. Yes, and they'll keep crying. So we advise as they are breastfeeding, they reduce the clothing, and when they are fed enough, then they allow them to sleep.
Okay, thank you very much. Well, just a quick reminder of who we have in the studio. We've got a psychiatrist, a gynecologist, a pediatrician, a pediatric cardiologist, and a general practitioner. The SMS number is 22355, 22355, or you can call us live in the studio, and that's on 4200 600. The next question is, I'm a man of 25 years old. I'm bald and on my head, and I'm not on any medication. Please advise. Baldness. This I don't know if it will go with you. By the way, for us men, it is a worrying thing.
I don't know whether you've got a Kojak or you're also balding, but he shouldn't worry. And the reason I'm saying this is we have what we call the changes after puberty. What happens to a young girl? She curves out. There's the breast that forms, the hips that form, as a result of the female hormone, estrogen. In the gentleman, their testosterone, which is their main male hormone, goes up. So you have the hair changes, you have some chest hair, you may have a beard that you develop. In some men, you actually start balding as a result of that particular hormone. If you read well, they say there's wisdom in boldness, so he shouldn't worry. He should actually take himself to be a very wise young man. Yeah.
Okay, maybe to the psychiatrist, and this is mainly to talk about the changes that we have in life. Why is it that we know it's coming, but we never seem to accept it? You know, you find somebody with a white hair and they're suddenly very worried. Oh my God, I'm growing old. Of course you're growing old. I'd be worried if you're not.
Yeah, psychologically, people will tend to worry if they feel that the previous stage they are moving from, they've not accomplished what they would have wanted to accomplish, especially with midlife crisis, where you find that a man or a woman, let me not be gender biased, feels that age is they're almost getting old and they didn't accomplish all the plans they had. But we prepare people also that as you grow up, make sure that your plans, whatever you're not able to change, whatever you're not able to achieve, that you accept it. Because you can only worry about what you can change and then change it so that you can stop worrying. The things you can't change, then you accept them and move on.
And move on.
Yes.
Thank you very much. Okay, we'll move on to another question. And for you, Dr. Kihara, I am 43. I had a blighted ovum at the age of 39 and had a uterine evacuation. What are the causes and can this recur? Can I conceive again? This is from Esther.
Esther, I know you're really looking for a baby at this point in time because we also know the biological clock is ticking. But a blighted ovum basically is when you have fertilization of the egg and it doesn't grow. So for some reason there is so-called demise, and you will find it either described as a blighted ovum or you may have had what we call a missed abortion. The evacuation was actually to clear the contents of the uterus. It can recur. And why I say this is as we get older, we also know the quality of our eggs are not as robust as in your younger age. So I would clearly advise her, since she is looking for another pregnancy, to actually consult with a gynecologist for two reasons. As soon as she knows she's pregnant, we need to follow it up even more diligently. And number two, we do know the biological clock is ticking. Sometimes we are even forced to kind of enhance the quality of the eggs that she is actually producing. Yes.
Okay, thank you. 22355 is the SMS number to call. It's 4200 600. That's 4200 600, and you'll be talking to the doctors live. Okay, I have a question here for the pediatric cardiologist. My son seems to have developed what they call a noise in the heart. What may have caused this and what can be done about it? I am very worried.
Thank you very much. A noise in the heart may mean a mama. I don't know how old your child is. It would have been important to know the age and to know when it developed, because sometimes there are mamas we call innocent, whereby it's picked by the doctor when a child has fever. It doesn't mean there's any problem. So there are mamas that are innocent, but I would have loved to hear more about that noise.
Okay, there's somebody here who even says, thank you very much, Dr. Gashara, you treated my child when they had rheumatic fever that had affected her heart. Please, doctor, explain to the audience the cause of the fever and how to prevent it. We're back to you.
Thank you very much. Rheumatic heart disease basically results from a sore throat that is caused by a bacteria which we call Streptococcus. It's not all sore throats, and I would want to emphasize this, and it's good it's Mother's Day, because we are all mothers. I would want to emphasize that.
Heavily outnumbered here. But yes.
Yes, I would want to emphasize that it's not all sore throats that resort to heart problem, but there's that specific sore throat that occurs suddenly. The child is not able to swallow and is quite sick, and it is usually between 5 to 15 years. So when your child